Welcome to City Club. It's really good to be with you here on this, what might be a snowy day. I wish to start out with a shout out and a thank you to our generous City Club sponsors. That would be INL, the Bank of Idaho, Fluor Idaho, ISU, the Idaho Humanities Council, Mountain View Hospital, KISU FM, who will be rebroadcasting this at some point in the future, next month, as well as the entity without which nothing during the pandemic would have been possible, it seems like, and that's IE Productions. This business has supplied the technology and some pretty finely tuned camera work that links us together for events like these. These are the organizations that help us to sustain the club, and they allow us to fulfill the ever important mission of City Club, which is sponsoring and promoting civil dialogue and discourse on all matters of public interest. As always, we strive to do so in a nonpartisan and non-sectarian manner, and we encourage broad participation from the community at large. That is then basically, you can boil it down to information and education for understanding's sake. That's what City Club is, and we're sure fortunate to have this kind of an organization in our community. Now, speaking of public discourse, the City Club is proud to announce that sometime in late March, we will be privileged to hear from Matt Freeman. He serves as the Executive Director of the Idaho State Board of Education. He'll be speaking to us about the challenges and the opportunities in higher education. That's always an interesting and relevant topic. Now, today's program is no less interesting, and it probably could not be more relevant to us. There is not a one of us who has not been impacted in some way by the COVID-19 pandemic. And if you'll forgive me, I feel I should note, by the way, that even as the overall COVID-19 numbers and that infection rate in Idaho is going down all across the state, we are seeing that the numbers in Bonneville County have begun to rise again, to the extent that we're one of the state's hotspots. It's likely that this is in response, or a response, I should say, to the lifting of Eastern Idaho Public Health's masking requirement a couple of weeks ago. And one of the things that we have learned is that it usually takes about 2 weeks for us to see changes in infection rates, up or down, after some other kind of a change is introduced. We also know that there's a correlation between infection rates and mask wearing. So as mayor of the region's largest city, I once again offer a plea for you to take care of yourselves and take care of the people around you. Please wear your masks when you're in public and when you're around people you do not reside with. Limit your interactions when possible, and pay attention to the opportunities to become vaccinated. And that's something that we'll hear more about today. We're privileged today. Our speaker, Dave Jeppesen, serves as a member of Idaho's, as a member of Governor Little's cabinet in the capacity of Director of Idaho's Department of Health and Welfare. In my profession, which is political science, there's something known as the rule of propinquity. And that rule is quite simple. It says that the closer you are to power, the more power you have. It's a rule, not a real one, but something that a political scientist posited. And the idea is that, the closer you are, the more power you actually have. Well, by that measure, our speaker today is a very powerful man indeed. Now, I haven't been counting, but I do not believe there have been very many, if any, press conferences in over a year where Dave Jeppesen has not stood next to our governor, at an appropriate distance, of course. I doubt that there have been very many strategic meetings held in the last year where Director Jeppesen hasn't had an important role to play. Today, this very powerful man is going to give us the benefit of his perspective on this past year. He'll tell us what he's done, what his department has done, and what he is still doing to impact how our state is addressing the pandemic. You might also be interested to know that Director Jeppesen was born in Burley, and he moved to Ammon when he was 10 years old. He attended Bonneville High School. Growing up, he says that he loved winter, perhaps days like today. He learned to ski at Kelly Canyon, and he spent many hours snowmobiling in Island Park and in the foothills of Rexburg. He was a Boy Scout, and he spent the 4 summers of high school and his first year in college working at the Salmon River High Adventure Base Camp on the Salmon River, about 50 miles downriver from salmon. Anyway, he did whitewater rafting and kayaking, as well as cliff rappelling. He says that as a young man, he could hardly believe that someone was willing to pay him money to have fun all summer long. Well, the director then tells a great story, about having to choose between that life, perhaps becoming a ski instructor in the winter and a river guide in the summers, or choose between that life or being the guy who was going to take his final exam in calculus, which was also going to be a decision to finish his college degree and pursue a career based on his education. As an 18-year-old young man, he says it was a difficult decision, but he chose calculus. And while he never did become a certified skiing instructor, he has had the kind of a distinguished career that brings him before us today. So I, for one, am grateful. Director Jeppesen is going to take some time to share with us his thoughts, after which Dr. Dave Adler, the principal at the Alturas Institute, as well as a member of the Idaho Falls City Club Board, Dr. Adler will take a few minutes to run the Q&A with Director Jeppesen. And so I invite you to submit questions that you may have to the chat, or not, we don't call it chat, to post your questions on Facebook, and we'll take note of those and make sure that we have a good dialogue. If you don't have questions, for Dave Jeppesen, we'll come up with some in studio, but I'm telling you, this is your chance to ask your questions. So, Director Jeppesen, we are delighted to have you with us. We know how busy your schedule is, and we thank you for sharing your time with us today.
Well, thank you, Mayor Casper. I really appreciate that very generous introduction. Thank you for that. And I'm just going to check to make sure you can hear me okay. Right, thank you. Thank you again for that wonderful introduction. I'm very fond of the Idaho Falls area. It's, as the mayor mentioned, it's where I grew up, and many fond memories of my growing up years there, and many of the very things that shaped my life, as the mayor mentioned, happened in that important community in my life. I'm going to take just a few minutes and give you some overview of the department, actually, and a little bit of history on public health in Idaho. Very briefly, and then talk a little bit more about the pandemic and specifically the role that the department has had in the pandemic response. So with that, I will dive in. So the Department of Health and Welfare is actually the largest agency in the state, and it has 8 different divisions. And let me just run through those quickly to give you the breadth of the things that happen in the Department of Health and Welfare. One of those divisions is Medicaid. So Medicaid is administered out of Health and Welfare. Another is behavioral health. And obviously that's a very important topic for Idahoans. A third, obviously, is public health, which is something I'll spend quite a bit more time talking about here in just a minute. In addition, we have a division that's Family and Community Services. And that division is primarily focused on things like child welfare, the foster care system, child protection, those sorts of things, as well as care for developmentally disabled children. We have our division of welfare, and that's the division that administers many of those programs, such as SNAP, or which is often called food stamps, or temporary assistance for needy families, which is some cash grants. Eligibility for all of those programs runs through that division. We also have a division of licensing and certification, and that's the division that licenses all of the healthcare facilities throughout the state. And so that's everything from hospitals to long-term care facilities, such as skilled nursing facilities, assisted living facilities, to residential treatment facilities, et cetera, are licensed in those 2 divisions. And then we have 2 internal divisions. One is IT, and the other is focused on our management services, which is where finance and HR and those sorts of things reside. So pretty broad scope across the departments. We actually interact with, every year, at least half of Idahoans in some way through the course of a year through the department. I did not know about all those things when I took this job, and I certainly didn't know there was a pandemic coming, but I've learned a lot in the 2 years that since Governor Little has appointed me to this position. I'm going to just give a very brief history of public health in Idaho, and then I'll kind of dial up to the current pandemic and some perspective and experience, at least from what I see through the pandemic here. So public health really was not very organized pre about 1915 in Idaho. And there was some public health that took place. Some counties had pulled together some public health departments to address public health issues. There was some state level public health that took place pre 1915. But it wasn't really until the Spanish flu of 1918, which really wasn't a Spanish flu, but that's the name it has, and was really the last global pandemic of the proportions that we're seeing today that took place, that really changed the face of public health across the state. After that experience, each county organized their own public health department or district, if you will. And the state public health department was, that's when the Board of Health was created at the state level, which still exists today. And there was this much stronger state level presence for public health that was created. And then about in the mid 60s, there was realized that having each county operate its own public health district or department was very inefficient. So you ended up with 44 of them across the state, as you know, and some of those counties were able to financially handle that, and some were not, and it didn't lead to the coordination that was desired. And so, in the mid '60s, there was legislation passed that created the current public health districts. You all live in the Southeast Idaho Public Health District, which aggregated counties, included at least one county that had a larger population. So in this case, Bonneville County would have been that county for this Public Health District 7. And that was created in the 70s. And that is really the public health model that we have today. It comes out of that legislation. And so just a quick history on how we arrived at where we are today. And fundamentally, the way the model works is at the state level, traditionally, the state has set policy and issued grants and contracts to the public health districts. And typically, most public health activity, actual giving of services, for example, happens with the public health districts, which have a combination of funding from the state, from grants, mostly through the department, vis-a-vis federal grants. And then also there is funding at the county levels for those public health districts as well. So that's just a little history on public health model in Idaho, and it's different state by state, and that's our history on that. I'm going to transition over and talk just a little bit about the pandemic. I'm sure all of you have had the pandemic change your lives in some way, and some may be good, some maybe not so good, but it's definitely impacted every single citizen in the country and certainly every person in Idaho. And the Department of Health and Welfare, specifically the Public Health Division of the Department of Health and Welfare, has really been engaged since the beginning. We actually activated our incident command structure a year ago, 2 weeks ago, in the middle of February, preparing for what we could be a pandemic. And our very first case in Idaho, our first confirmed case, I don't know if you remember, was in Blaine County around the Sun Valley area on Friday, March 13th was our first case in Idaho. And that really started a pretty rapid set of events. And I'm going to frame this from a perspective of the department's role throughout the pandemic. And so early on, what we did is the governor formed a coronavirus working group to advise him, and that still operates today. Has membership from hospitals, from the Idaho Office of Emergency Management, from schools. Superintendent Ybarra is on that group, and health experts on that group to advise the governor. And the very first problem that we ran into was really around personal protective equipment for healthcare workers. And for years and years and years, the healthcare system had moved to the most efficient delivery of those supplies, which is just-in-time manufacturing. The problem is when you have a surge in demand, then all of a sudden you run out of inventory and you have a short supply. And that's actually what we experienced in the first few months, actually just about a year ago, across the state and across the country. And so our initial role really was spent a tremendous amount of time trying to procure, locate, have donations any way we could find to gather personal protective equipment for healthcare workers. What we were finding is because we knew so little about the virus, healthcare workers were using PPE clearly for their own safety as much as they could. And I had the hospital in Sun Valley actually had a spike in cases. That's where we really had our first large number of cases in the state. In fact, in April, The Blaine County area was the second highest rate of infection in the country. And the hospital there went through their 60-day PPE supply in 2 days in that hospital in the Blaine County area, and that was kind of the magnitude of that. And I remember getting a call together on a Sunday, late March, early April, with hospitals who were saying they literally had less than 24 hours of PPE left if supply of their hospitals. So that was really our role, was to help coordinate where is PPE around the state. Who is not using it? How do we get it transported to where it needs to be? And how do we find more of it out of the supply chain? And that dominated the first probably 30 to 45 days of our pandemic experience. And in fact, if you recall, the hospital in Sun Valley actually got to the point where they had so many of their healthcare workers that were ill. They had almost 50% of their staff out, either because they were ill or because they had been exposed, that they actually had to close that hospital. And move the patients down to their facility in Twin Falls. And that's when really got our attention. When we had a hospital actually close, is when we became very, very, very concerned. As we moved through time, the next kind of phase of the pandemic really was about information sharing, data, and dashboards. And I do feel that that is a critical function that public health plays, is to share the data that we have. Hopefully you've been out to see our data dashboard that we have. I'm going to show you the one here in a minute we have for vaccinations. That lists number of cases, how testing is going, what our testing positivity rate is by county. It shows by county case rates. The mayor mentioned that we're seeing a little tick up there in Bonneville County, so I echo her comments. So please choose to be careful and to take those precautions that protect you and others. And also the number of hospitalizations across the state. So we've started with just one piece of data and have expanded that out to a full dashboard to really make sure that everybody's operating from the same data of what is actually happening with the pandemic. And that's been a key role that the department has played through this pandemic. The other thing that happened during the summer months was really an approach to testing. If you recall, we had a real shortage of testing across the country, and that certainly was the case in Idaho. And that was difficult. So for many reasons, if you were sick and had symptoms, you'd want to know if you had COVID or not. And testing was either in short supply or was taking up to 2 weeks to get test results back. So one thing we did was gathered all of the testing experts from across the state and created a testing task force that really tackled both the policy of how we're going to approach testing, how do we prioritize given the limited supply, who should be tested, and how do we increase our capacity across the state for testing. I'm happy to say that today we do not have a capacity constraint on testing for COVID. In fact, we've given in the last 11 months, over 1 million COVID tests have been administered across the state, and over 650,000 individual Idahoans have had a COVID test at some point over the past year. And currently we do not have a capacity constraint on testing, which is a much better place to be. That was not the case last summer, and it was a critical role for us is to figure out how do we increase that testing capacity across the state. The next phase for us in the pandemic really entered the large spike that started in October, spike in cases, and really peaked in about mid-December with the number of cases in the state. And the real problem from that, and something that the governor and I talk about often, is the real danger from the pandemic is running out of healthcare capacity. We started to see the number of cases rise. About things in the pandemic happen in 2-week increments. So as the mayor said, if you change a policy, it takes about 2 weeks for that to take effect and have seen a change in cases. After cases start, about 2 weeks later, you see what happens in the hospitals. And about 2 weeks after that, you see what happens with the number of deaths across the state. And so we started to see this very large spike of cases that were now being hospitalized. And we actually came dangerously close in December to actually running out of healthcare capacity across the state. And so a role that the department played was we actually were daily, every morning at 7 a.m. calling we had all the hospitals call in so we could coordinate resources. Who has the bed open today? Who has the staff that's available? Who has, fill in the blank resource that's needed to meet a need in another area, to coordinate and to help drive those resources so we can make sure that we had the maximum use of resources, so we would not move to a place where we literally ran out of healthcare capacity. We had several hospitals that were unable to take patients for a day or two or a week at a time, and our role really was to help coordinate all of those activities, coordinate the resources, and keep the communication going between hospitals so that we could move patients around or supplies around to ensure that we could get people in to be taken care of. And that was not just for COVID patients. That extra amount of COVID patients coming in was meant for all patients. That capacity was scarce, and so we did not want to end up in a situation where somebody had a car accident and we were not able to take care of them because the hospital was full. And so that was something we worked very hard on. Fortunately, many Idahoans followed the directive from their local public health districts and guidance that we gave at the state level, and we saw a turnaround in the number of cases in December. And thank you to all of the Idahoans for taking those individual actions that made that difference. And today, our hospital capacity looks really well, particularly in East Idaho. Actually, the hospital capacity at the moment is doing very well, almost back to normal, actually. And we hope to keep it that way. So that brings us to kind of the last phase of this pandemic, which is really the vaccination phase. Well, I hope it's the last phase. We'll see if it's the last phase or not, I guess, which is our vaccination effort. And there's really an amazing miracle of modern science that has occurred here. In January, over a year ago, January 2020, the coronavirus was identified and it was genetically sequenced in mid-January. And 42 days later, the very first vaccine was put into clinical trials based on that genetic sequencing information. And that was the Moderna vaccine, and Pfizer was just a few days behind that. And that was truly amazing. And it is amazing that we've now run massive clinical trials with tens of thousands of volunteers that said, yes, I want to be part of establishing if these vaccines work. And we've ended up with, in less than a year, 2 vaccines that are amazingly effective, amazingly safe, 95% effective in terms of preventing the disease. Amazingly safe. There's been no deaths from anybody getting vaccinated. We've had 2 anaphylactic shocks in the state of Idaho. And of course, there are some mild symptoms like a sore arm and those sorts of things, but there's no major side effects. And that's truly amazing. So in December, when those vaccines were approved for emergency use by the FDA and then approved by CDC, we actually had our doses arrive the week of December 15th, just a day after they were approved. And the very first vaccine shot in the state was given up in Rexburg, actually, in Madison County. And then we took off from there. The vaccine process has some challenges, and they start with logistical. So the vaccines that are currently out require very cold storage. Actually, they just changed the guidance on one that was the ultra cold storage. So that creates challenges. The other challenge is that you have to have 2 doses, and that actually makes it a little more difficult, right, than a 1-dose vaccine. It does make them more effective, but it's made the logistical challenges even more difficult. And we have very limited supply is the other big challenge that we have with the vaccines. And that limited supply means we have to make decisions about who and which priority groups go first. We've followed the federal level, it's called ACIP, the Advisory Council on Immunization Protocols, I think is the P, who sets some recommendations at the national level. We formed the Idaho Coronavirus Vaccine Advisory Group, and they make recommendations on the priority groups in Idaho. And we started with healthcare workers because our number one goal was to preserve healthcare capacity. And then we started with long-term care centers. As obviously that was our highest risk congregate living setting that we had in the state. And then we've gone through first responders and teachers, and now we're in the 65 and older group for vaccinations. And I'm going to share my screen here just for a second and show you some of our dashboards that we have here. This is on our coronavirus.idaho.gov website. And on this website, you can see a big button that says when and where to go to get your vaccine. And then down here is some vaccine data at a glance. You can see that we've had 336,000 doses administered across the state. And of that, 227,000 people have received at least 1 dose. It breaks it down by first and second doses there, and our case counts below. Here on the screen, there's two buttons. One is the new vaccine administration transparency data, and that's really data about providers, about vaccine providers. We have 450 vaccine providers across the state, and that lists the data that's happening for providers. This one parallel to it is our COVID vaccine data dashboard around people. And so the total numbers are match on these, but the people one would be if somebody in Rexburg gets vaccinated, that would show up as a vaccination in Rexburg and in Public Health District 7, which is where you all reside. But if that person had traveled to Bonneville County to get that vaccine, on the provider side, that would show up as a vaccination done in Bonneville County and still within Public Health District 7. Or if they'd gone to Pocatello to get that vaccine, they would show up as in Bannock County and Public Health District 6 for where that vaccine was administered. And so that's why we have two different buttons here. One is the provider view and one is the people view of what's happened. And if you click on the provider view one, let's see if I can pull it up here. That really lists out, that came out of the governor's executive order, and it lists out how we're doing with getting vaccines administered. And I'll let that load up there. And so you can see a map of Idaho. It shows percent of doses administered by public health districts. Statewide, we're at 83% administered of shots received. And then it breaks it down by health district and some of the federal programs, and then by individual provider. This includes both first and second doses. Earlier this week, we actually were 5th best in the country for doses received versus doses administered. We're still in the top 10 here towards the end of this week. We get more doses in, so it changes that number pretty regularly. But we're doing much better than we did at the very beginning in terms of getting doses out into people's arms. Whereas if you go to the people tab, that shows you by county and I'll click on this here. It shows you by county and health district what percentage of people have been vaccinated. And you can kind of hover over and it'll tell you specific information for each of those counties and districts. And then I'll just go back over here to highlight that for people 65 and older, we have had 42% of those individuals that have gotten at least one shot so far. So that's been our latest focus, is really the vaccination effort. We expect that to continue for some time. The Johnson & Johnson, their actual brand name is Janssen, excuse me, vaccine is being reviewed as we speak by the FDA. That will be the third vaccine that would be approved, should it be approved. And that vaccine is unique in that it's only a 1-dose vaccine, and it also does not require to be frozen. It can be refrigerated. So that makes it much more friendly for particularly hard to reach populations, for rural areas, for those types of situations. That vaccine is going to be a little bit easier to use. So I'll give you an example. For the homeless population, it's going to be a lot easier to do a 1-dose vaccine than a 2-dose vaccine. It's simply because sometimes it can be hard to find that person for the second time. And so once we have them, we can do it once and be done with that. We'll see what the data says as they review it today. It probably is going to have a less effective number than the Pfizer and the Moderna. The Pfizer and the Moderna are off the charts good, but this is still a good vaccine. We'll see what the actual number of efficacy is. But the number I would emphasize is that the clinical trials, the Johnson & Johnson vaccine was 100% effective at preventing somebody from going to the hospital or having such a severe case of COVID. If they did catch COVID, that they would go to the hospital. So for me, that's a pretty good statistic that it was 100% effective, at least in the clinical trials, at preventing anybody coming into the hospital. So we'll see what the data actually says later today, and then that will add to our vaccine supply. Currently, we're getting about 40,000 doses a week into the state. That's first doses. So total doses is close to double that, but the first doses is about 40,000. Our goal is to get them in arms in 7 days, and we're doing extremely well at that across the state. And we're also seeing that people are getting their second doses right when we would expect them to, which is also great to see. And we think that vaccine supply will continue to increase. We have an estimate that Johnson & Johnson vaccine might be about another 10 to 15,000 doses a week, which would put us up to about 55,000 doses a week. And with the new contracts that have been put in place at the federal level, it's possible by the end of March or April, we could be getting 100,000 first doses into the state each week, which would alleviate the supply issue that we've faced for the last over 2 months now. And so with that, that's a quick view of the pandemic. Again, our role has been mainly around coordinating resources, sending public messages. In the vaccine rollout, I should say that's been our main role, is to set up the committee to drive the prioritization process, and then to drive that public level coordination effort of getting doses out to the various parts of the state so vaccine providers can administer them. And then the last thing I just want to say is we do know that we have the new variants are in the states. We have a two confirmed cases of the South Africa variant here in the Treasure Valley, one case of the UK variant here in the Treasure Valley. And we know that it's here in the state and probably in most parts of the state. Those new variants are much more contagious than the variant we've had so far, meaning it spreads much more easily. And so we really are in a race. We're in a race to get as many people vaccinated as we can before these new variants cause another spike in cases and hospitalization to occur. So we encourage folks to, if you so choose, to get vaccinated, and also encourage everyone, as the mayor did, to continue those practices of physically distancing and wearing a mask, and encourage you to choose to do so, particularly as we have this new variant that's coming into the state. We would not want to see us get back in a situation where we are close to running out of hospital capacity. So thanks to all of you for the great efforts you've made throughout this pandemic, and it's made a difference in the various aspects that I talked about today. So with that, Mayor, I will end my comments and we can do some questions.
Thank you very much, Director Jeppesen, for those very valuable and helpful and illuminating remarks and insights into our battle against this dreaded virus. I'm Dave Adler. I'll be the moderator. It's my pleasure to pitch some of the audience's questions to you. And before we do that, I note that by virtue of this Zoom link, you have engaged in something of a trip back to your roots. Having grown up here in southeastern Idaho, and I note having been an undergraduate at Idaho State University, and of course there are many of your fellow Bengals watching today who will take pride in not only your remarks today, but your performance as director of this massive agency. And let's start there for just a second. You noted the many responsibilities that the department has. You have a huge budget, roughly $3 billion or so, and most of that's federal money, I think, and you certainly can correct me, but doesn't your budget consist of roughly $700 or $800 million from the state? Could you talk a little bit about the sources of revenue for your department?
Sure, happy to do that. Excellent question. So our budget this coming year that's being up for approval on Monday and the following Monday is $4.2 billion. Roughly about 800,000 of that, 800 million of that, is federal state funds, The vast majority of the rest of that is federal dollars, but we do have what is called dedicated funds. And mostly that's made up of what we would call receipts. So for example, in the Medicaid program, we will get pharmacy rebates, and that would be a receipt we receive from the pharmacy company and goes into what's called the dedicated fund. And so that's the three buckets: is dedicated, general funds, which is state money, and federal funds. And the vast majority of that is federal funds.
Yeah, and so your funding to fight COVID is largely provided by the federal and the state government, and in what proportions? Can you give us a rule of thumb?
Yes, that's a great question. Almost all of the money that we've spent for the COVID, for the pandemic response, has been federal money, and that's come through the various bills that have gone through Congress. I think we're up to 4 now, and roughly about $400 million of federal money has flowed through the department, or will flow through the department as part of the pandemic response. We actually have used no general funds in the pandemic response. It has all been federal dollars.
Good. So that's a very good thing for Idahoans to remember, that the federal government is funding this fight. Now, you have used that very nice word that we're in a race to vaccinate Idahoans. And I assume that in order to fully vaccinate Idahoans, allowing for some who will decide not to take the vaccine, we're talking roughly 3 million doses, something in that neighborhood, if everybody requires roughly 2 doses. Although that can change, as you pointed out, because science is indicating that maybe 1 dose from some of these companies may be sufficient. But if in fact that's our number, what's your goal for fully vaccinating Idahoans at that rate, would you say?
Well, ideally, and this will all depend on supply, we would love to be at a place where we have enough Idahoans who have had access to the vaccine and choose to get vaccinated, that we could be at a really good spot before the kids go back to school in the fall. And the reason for that is, the virus is more active when winter and fall come along and people go inside. And although we don't see a lot of spread at schools per se, it's a signal that people are headed back indoors and et cetera. And so that would be our goal. In order to hit that goal, we would need to see our vaccine supply increase. When we started, we had 15,000 doses a week. Those are first doses. We're now at 40,000 first doses a week. And if the federal government is able to have their manufacturing hit the level they think it will, we could be at about 100,000 first doses a week by the end of March. And at that rate, there would be enough doses available that by the end of summer, we could be in a position where we are getting back to some sense of normalcy. But it's really going to depend on the number of vaccine doses that come into the state and if that supply increases.
Yeah, thank you. And so everybody hopes that you can move as quickly as possible. We all want that magical return to normalcy. As you discuss the logistics involved and receiving the necessary support from the federal government, we all recognize that you've faced daunting logistics in every way, shape, and form. Let's start with some talk and some promises way back last fall to try to answer some of the questions raised by our audience. Many Idahoans remember, of course, that last fall, the Trump administration during the campaign had said that it will deliver hundreds of millions of doses by the end of the year. That fell flat. That didn't happen. But do you have any insight into why why that goal wasn't met, why the reserves that were promised, in fact, weren't available?
Yeah, that's a great question. I think there was hope that the vaccines would have an emergency use authorization in the October timeframe. And clinical trials are clinical trials. You have to finish those. You have to run them. You can't cut corners on that. And the companies and the federal government were very good about not cutting any corners on the actual clinical trials. And the clinical trials run, basically you give roughly half the people the actual vaccine and half a placebo, and then you wait and see who gets sick. So perversely, when the virus is spreading quickly, you actually have shorter clinical trials because more people get sick. And when you have less virus spreading around, it actually takes longer because you have to wait to see if people get sick. And so you really can't control that. And so what ended up happening is that to really get a full, robust clinical trial outcome, that didn't happen until December. And so that didn't leave much time, obviously, before there in the end of the year. Actually, December 15th is when that approval came to get doses out. And so that's, I think, one of the big drivers. And then from a manufacturing perspective, I have less visibility into that. I do know that the manufacturers are running at full capacity and have been since last fall. And I think countrywide, there was about 20 million doses distributed, or roughly in that ballpark, kind of in the first 30 days that we saw the vaccine coming out. So it really is a function of you got to let that science run to make sure you know what you know about the clinical trials.
Thank you. So you mentioned, Director, that so much of our ability to combat this virus hinges on on the supply chain. Can you walk us through some of the other problems that you've faced in terms of distribution to Idaho? For example, we would ask, now that you mentioned that we're receiving something like 40,000 doses a week, do you believe Idaho has received its fair proportion of the vaccine available throughout the nation? If not, why not? Any insights on that point?
Yeah, that's a great question. Our first goal was to make sure that all the doses we were getting, that they were being administered within 7 days. And I think I mentioned we were 5th best in the country earlier this week at doing that, and something that I personally am pretty proud of all of the healthcare providers for really doing a great job with that, actually. So then the next question is, are we getting our fair share of doses? And there are a couple of factors to consider there. First is that the doses are distributed based on adult population. And so when we first looked at the data, it looked like we were getting less than our fair share. And when we looked a little closer and talked to our federal partners, it was because it's based on the population 18 and older. And Idaho has the 3rd largest proportion of children of any state in the country. Actually, Texas and Utah are the only 2 states that have a larger proportion of children than Idaho. And as a result of that, if you look at it on a total population basis, it didn't look like it was the right number. You have to adjust for that. But even after you adjust for that, it still didn't look like we were getting what we would call our fair share. And after further conversation with our federal partners, they indicated that they were using 2018 census data to get those numbers. Well, as all of you know, Idaho is and was the fastest growing state in the country. And so using 2018 data did not reflect the actual growth that we had seen in the state. And so we've had a conversation with our federal partners. They're in the process of switching to the most latest census information. And that will actually should fix our allocation problem that we've had to date.
Thank you. As you well know, a number of citizens have complained about different parts of the process, the thought process into determining whom should receive the vaccines before others. All those kinds of decisions crop up. And of course, your friends in the legislature have been challenging some of the district health decisions. Let's take a look for a few minutes, please, at the thought process first for delineating who's at the top of who is first in line, working down that process. And then secondly, what is your response to what we would call some partisan attacks on the general approach to these decisions? And mind you, you're here in a group of friends, fellow Bengals, here in southeastern Idaho where you grew up. So no pressure here, Director.
Well, maybe I should say go Bengals before I get too far down the answer here.
You just won votes. If you run for office, you just won a lot of votes with that.
Very good. I don't think there's much risk of that happening. But, well, yes, actually, I wish we were in a situation where we could give everybody that wants to be vaccinated a vaccine right now. And I really wish that was the case. I know there's many Idahoans that wish that was the case. Unfortunately, that's not the case. And we have roughly, 1.5 million adults in the state, 1.4 to 1.5. And we're getting, as I mentioned, 40,000 first doses, 80,000 total doses a week. And so you can do the math pretty quickly to see that that's, it's going to take a while. And so that means we had to make some decisions about which groups went first. And those are hard decisions. The first group, and we've relied on the federal guidance for that. The first group was healthcare workers, which made sense. We're trying to protect our healthcare capacity. That's been our goal from the beginning. And then obviously long-term care centers, where you have the group, the most at risk for death and serious disease are those that are older. And obviously within a congregate living, like a long-term care center or a skilled nursing facility, the risk is very high. And so that was obviously the first group we went to give the vaccine to. And then after that, it becomes much trickier. Because you have competing interests. So for example, we for sure wanted to get first responders. They're out with the public, they can't choose to stay home, and we need them. we need those first responders to be available and healthy. We made a choice to have teachers. The committee, the CVAC, made a choice to have teachers. And that's because we want kids to stay in school. But we also have competing interests for those that are over 65 and the most at risk for severe disease. So that was the group we went to next, or the committee recommended we go to next. And you're seeing, I don't know if you watched that CVAC, the Coronavirus Vaccine Advisory Committee meets every 2 weeks. And this last meeting on last Friday was a really tough meeting because the debate started about where do we go next? And you have lots of competing interests there. I get many letters and emails each week from individuals arguing their case that they should be next, or their group of people that they represent should be next for who should get the vaccine. And I wish I could vaccinate them all tomorrow, but we're going to have to make some tough choices in there. And so CVAC is wrestling with where do we go from here? What's the right direction to go for who should be the next group to get this limited supply? Obviously, as we get more supply, those decisions become a lot easier because we can get lots more people vaccinated. But it's been pretty tough, and I understand and hear people's concerns and frustrations, and we'll continue to do the best we can with our committee to work through those very tough decisions.
Thank you, Director. Now, as you well know, Governor Little and the advisory board have indicated that they're going to follow the dictates of science in fashioning these policies. How helpful have CDC guidelines been to your decision-making? And are you in touch with officials at CDC as you approach some of these tough decisions?
Yeah, actually, CDC has been incredibly helpful. They are a world-class, and I would say best in the world at disease control. And certainly during the pandemic, I have seen that happen in just amazing ways. And we've relied heavily on them for the science and the research. We have a very talented state epidemiologist. Her name is Dr. Chris Hahn. She's actually on several of the CDC committees. And she's really been our main contact back to our partners at CDC and has pretty regular meetings and joins their meetings regularly via Zoom to participate in what's taking place. And that's been a real blessing for the state because to have just somebody that's directly connected to the CDC. When we started this pandemic, we knew very little. We've learned more. We still have a lot more to learn, but it's been great to be plugged into the closest source possible with what's happening on the science front.
Thank you. A couple of questions regarding children, since you mentioned people under 18 years old a little bit ago. We don't know yet what the impact of the vaccination might be on children as far as we know. Maybe you can enlighten us on that. What are the plans for vaccinating children here in the near term and the long term? What's the thoughts of the advisory committee on that?
Yeah, that's a really good question, and one we get often. The clinical trials that led to the initial emergency use authorization did not include children. And the reason for that is the disease burden was really being experienced by adults, and particularly those over 60 years old. There are clinical trials underway right now that do include children, and we expect those to conclude, and then there'll be recommendations to the FDA and CDC. As I mentioned earlier, those clinical trials depend on how many cases are happening in the community. And fortunately, right now, we've seen a drop in the number of cases, not only in Idaho, but really across the country. And so that actually has slowed down the clinical trials, unfortunately. So when I last talked to Dr. Hahn, who's our medical expert here, as I mentioned, she's anticipating that somewhere between late summer and the end of the year would be when we'll find out when vaccines would be approved for children.
Thank you. And back to the thought process of the advisory board for just a second. One of our members would like to know about the decision to place teachers near the front of the line, which, by the way, the questioner believes is a no-brainer, and wonders, frankly, applauding the wisdom of the board, why haven't other states? Not every state has placed teachers near the head of the line, and doesn't that complicate or really undermine the opportunity of opening schools across the country? Do you have any insights into your partners in our neighboring states and across the country?
Well, yes, there's the official ACIP, at the Advisory Committee for Immunization Programs, guidance out there, and that guidance did not have teachers ahead of the 65 and older group. Idaho, it tends to be a little independent, and the advisory council looked at that and said, we really want to make sure that we can preserve the integrity of our school systems and make sure kids get back to school if they're not in school, and make that as safe as possible for the teachers and staff. And so that's what drove that decision. From the governor, in my perspective, our number one goal has been to preserve healthcare. Equal to that is to make sure we maximize economic opportunity or minimize economic impact. And then right behind that has been, how do we keep kids in school? And if you listen to the governor talk, he talks about that often. And because of those goals, that was why we made that decision to move teachers up early in the process. It wasn't without controversy, but I think it's going to have a really good impact on our schools and our kids that go to school here across the state. I think other states have stuck with the ACIP recommendations, and obviously they have their own situation in those states and processes for making those decisions. But we feel really good about moving teachers up early in the process.
Thank you. Let's turn for a second to a couple of the criticisms among opponents or those who might consider themselves part of the resistance to the general approach. Point one, as you well know, despite the fact that you're encouraging people to socially distance and wear masks, a fair number of Idahoans resent that. They argue that it undermines their freedoms, violates their liberty. How do you respond to the point made by those critics that encouragement, far less than a requirement, to wear a mask is a threat to their liberties?
I think in any public policy, you always have to respect an individual's right to choose. And so we've encouraged and invited citizens to wear masks. And then our strategy has really been to educate on the effectiveness of that. And there's lots of great scientific research on how effective mask wearing is at preventing the spread of the disease. And then obviously in some cases, public health districts have actually required that as well. But our view is that we need to make sure we're really clear on the information that says this is really effective, and connecting that to what matters to people. And so for some folks, that means protecting my elderly parents from getting sick and potentially dying. For some, that means being able to get their kids back into school. And it's been very challenging to do school from home or school online. For some, it means making sure that their employment is not disrupted. And so our job has been to say, it's your choice, but here's the benefits. It slows the spreads of the disease, it preserves healthcare capacity, and it also protects the economy. It keeps the economy open, and it keeps our kids in school. And so that's really been our approach, is one of an education and encouragement approach.
Thank you. In your view, asking citizens to wear a mask, is that much different than asking people, say, to obey the rules of the road while they're driving, or to obey red lights and green lights when they approach them?
Well, it's certainly very similar, because those are all set up for public safety. It's to protect yourself and others. And so the reason we stop at a red light is so I don't get hurt and you don't get hurt. And it's really the same principle for these masks, so that, like I said earlier, so that I don't get sick and you don't get sick, and more worse, we don't expose those that have severe cases and could die. And but more importantly, as well as that, or not more importantly, but in addition to that, is to keep the economy open and our kids in school. So it's a very similar principle, that public health is really an activity that requires a community effort, just like traffic laws require a community effort.
You mentioned, obviously, we're in the grip of a pandemic, and the numbers rise and fall depending on which county we might be discussing here throughout Idaho. As you well know, there are a number of legislators currently who would like to see the declaration of an emergency lifted, a declaration that there is no longer an emergency. What's your professional response to that assertion that we are no longer facing an emergency?
Yeah, and I think the governor spoke to this early in the session, but there's two aspects of that. One is we're definitely having a pandemic. Nobody asked for a pandemic. Nobody wanted a pandemic, but we are having a pandemic, and it has a real impact on people's health, the economy, school, all these topics that we've talked about. And until we get enough people vaccinated or who have actually had it, we are in a pandemic that is a public health emergency. And then the second is the emergency declaration that the governor's made really is a vehicle to make that clear, but it also is a vehicle that opens up certain federal funding. And so not having that in place not only limits our ability to mobilize here on the ground, but it would also interrupt our federal funding for some of the pandemic response that's taking place.
Thank you. And just to clarify, if in fact the emergency was repealed or we had a declaration that we're no longer under a state of emergency, as you pointed out, we would lose access to vital federal funding. And given the fact that our fight here in Idaho against the pandemic is entirely funded by the federal government, what would that do to the ability of our Idaho medical professionals and others to combat this virus?
Yeah, so the funding that is at risk, excuse me, is FEMA funding. And so what we would lose is we would lose access to the National Guard, which have been very helpful actually in our response. There are certain activities that are being funded by FEMA. And in fact, many of our vaccine efforts are now switching over to be funded by FEMA. So we would lose access to that. We have a very strong partnership with, for example, the VA hospital system throughout the state. We would lose our ability to partner for vaccinations and testing with them. And there's funding that is being put into place to help set up additional testing sites, for example, and we would lose access to that. So I want to be clear, we wouldn't lose all of our federal funding, but anything tied to FEMA is what we would lose, and it would have a direct impact to our vaccination effort, our National Guard partnership, and then the federal, like the VA hospital, et cetera, across the state.
Thank you. And Director, I'm afraid that our time together is rapidly coming to a close. But before we reach that witching hour, let me shift gears. Given the breadth of coverage and responsibility under the Department of Health and Welfare, which you lead, I want to ask a question about a particular bill that was just passed, as you know, to provide for a large supplemental appropriation for Medicaid and Medicaid expansion, and it barely cleared the House. And there were expressions of concern about the cost of those programs, but nobody seemed to mention that there might be substantial savings to the Idaho CAT Fund or the county indigent funds. Can you speak to that, please?
Sure. That bill is related, to a broad swath of Medicaid, but one of the big drivers in there was Medicaid expansion, which has come in higher than we expected. However, having said that, as a result of Medicaid expansion, there have been many state-funded efforts that have no longer needed state funds, including tens of millions of dollars right here in the Department of Health and Welfare. Many of those behavioral health services we provided previously are now covered under Medicaid, freeing up those general funds, or being essentially cost neutral to the state, actually freeing up general funds, and we can use those elsewhere. There are certainly other funding mechanisms across the state, including in the courts at the county level, that have been very positively impacted by the expansion of Medicaid. And when you look at all those puts and takes, it actually comes out to be fairly budget neutral on a general fund meaning state fund basis across the state, even with the increase that's taken place. So that's what we see in those numbers. And then the reason the numbers are higher is simply because you have a population of people, about 100,000, who've not had access to healthcare before. And so we see many folks getting behavioral health services, hips and knees replaced, chronic conditions being treated. We expect that to be high, but then subside as those conditions are treated and taken care of as we move forward.
Thank you very much for that clarification. Director Jeppesen, we're very grateful for your participation here today with the City Club of Idaho Falls. Your remarks have illuminated our understanding of these vital public health issues that we're facing today. It's been a pleasure to host you. Thanks again for joining us.
Thank you for having me.
Great.
Good to be back home virtually.
That's exactly right. We'll see you soon. And ladies and gentlemen, let me remind you that the City Club of Idaho Falls will host Matt Freeman of the Idaho State Board of Education in March. We hope you'll join us again. Stay safe. Thank you.